Thank you very much. Ladies and gentlemen of the House, with nearly 23 million children and adults in the United States living with this disease, it is indeed time to reassess our own fitness and nutrition choices, to educate ourselves on the risk factors, and then encourage everyone, especially our loved ones, to get tested. In my home state of Georgia, approximately 700,000 children and adults, or 7.8% of Georgia's entire population, have been diagnosed with diabetes. Raising awareness about this devastating effects of diabetes can have on people and their families must not go overlooked. Many people do not realize diabetes is the leading cause of blindness among adults between the ages of 20 and 74 years old. It also contributes to serious health problems such as heart disease, stroke, and kidney failure. And nationwide, 23.6 million people, or 7.8% of the nation's entire population, have diabetes. Further, 17.9 million people have been diagnosed, 5.7 million are undiagnosed, and at least 57 million people are pre-diabetic in this country. And 220 million people have diabetes worldwide. These are startling statistics, and the numbers continue to rise. Sadly, thousands more are at increased risk of getting diabetes because of advancing age and obesity, sedentary lifestyles, unhealthy eating habits, and insufficient physical activities. Diabetes not only affects the health of our nation, but our economic well-being as well. In my state of Georgia, the cost of diabetes due to medical care, lost productivity, and premature death is over $5.1 billion per year, with $357 million lost in my own congressional district alone. Early testing is crucial to saving lives and even preventing the onset of the disease in the first place. When diabetes is diagnosed in later stages, the treatments are more extreme, more difficult, and hospital visits more frequent. Catching the disease in its early stages helps patients mitigate the harmful effects early. As a member of Congress, I want to ensure that I do everything in my power, along with all of my colleagues, to ensure that Americans are empowered to take control of their health and get tested. I will also continue to work with my...
Could I yield additional minute to the gentleman?
Thank you.
Your additional minute is granted.
Thank you, Mr. Bone. I appreciate that. I also want to continue to work with my colleagues in Congress to address juvenile diabetes, especially with our children, because it can be prevented at an early stage with just testing and care, and increased funding for additional research as the number of cases continue to steadily increase. Again, I'm honored to observe November as American Diabetes Month, and I'm hopeful with this increased awareness of this devastating disease, we can save more people from being diagnosed with diabetes. We can lick this. There is a cure. All we have to do is put it as a priority it needs to be, and we will save lives, millions of lives. And I certainly appreciate and commend Mr. Pallone and the gentlelady, Mr. Jett from Colorado, for authorizing this important resolution. Thank you, Mr. Speaker.
Gentleman from Georgia yields back.